Having a baby is one of the most joyous experiences you can imagine, but for some, it isn't. I'm Dr. Jill from Tampa, Florida, here to tell you how to know if you're suffering from postpartum depression. First of all, it is very important to know that moodiness, tearfulness, sadness can be very normal, but we have to be able to recognize when it's not. First of all, if you're starting to experience these feelings, or if it gets even worse, like you're feeling like you want to hurt yourself or hurt your child, that's not normal and you need to be seen immediately by your healthcare provider. In general, you're tired after you have a baby, and that can lead to the same symptoms as depression. Well, you can't get rid of the tiredness, you still have to be awake taking care of your baby, but when it becomes a little bit more, for example, if your husband says something to you and you immediately start crying, probably that's related to being tired and being postpartum. The changes in your hormones, you for 9 months had a lot of hormones going, and then all of a sudden they cut it out when the placenta left. That can cause this, and it, like I said, can be normal. But if you're persistently crying, if you don't want to touch your baby, if you don't want to hug your husband, all of these can be signs that something more serious is going on, and get to your healthcare provider. 10% of women suffer from postpartum depression. 1 in every 1,000 pregnancies can result in what's called a postpartum psychosis, which is even worse than depression. That's generally when someone who's very normal all of a sudden says, I feel like taking my baby and throwing them down the stairs. Get those patients to a healthcare provider immediately. I'm Dr. Jill, and I hope I've told you how to know if you're suffering from postpartum depression.